Okay. Sige. We have two types of corticosteroids, again produced by the adrenal cortex of our adrenal medulla, located right above the kidneys. Okay? Ano, nawala ako right now. Adlaw na siya. Anyway, so again, we have two types of corticosteroids. The first one is called the mineralocorticoids. And then this one here is the glucocorticoid. Glucocorticoid. So actually, yung question mo should not be about the difference between the corticosteroids and the glucocorticoids. Kasi si glucocorticoid is just a type of corticosteroids. Ito dapat yung i-differentiate natin. Si mineralocorticoids and si wrong spelling wrong. Tingala ko bro, short man. Glucocorticoids. Okay. So itong dalawa ang kailangan nating i-differentiate. So again, both of them are released by the adrenal cortex of the adrenal medulla, but they have different activities inside the body. Itong mineralocorticoid class is concerned in the salt and water. Salt and water like retention in the body. Okay? So yan yung trabaho kasi ni mineralocorticoid. Nagre-regulate siya ng pag-use natin ng salt, especially sodium. And at the same time, syempre, if there is sodium, water will come next. Kasi remember the osmosis. So sabayan silang dalawa. So we have here the best example of our mineralocorticoid is our aldosterone. I believe hindi yan siya bago sa inyo kasi we have discussed that one especially during our discussion sa hypertension. Okay? Na-discuss ko yan sa inyo na nare-release yan siya sa adrenal medulla. So adrenal cortex is a part of the adrenal medulla. Now, diba si aldosterone, pag meron kang maraming aldosterone in the body, that will prevent the excretion of the salt and the water. So salt and water will remain inside our body. Our problem is if the sodium remains in the blood and that water follows after, and there will be an increased volume of our blood. It is not good for a person with hypertension or other cardiovascular diseases like heart failure. Okay? Though some of our sex hormones also have mineralocorticoidal actions. May mga sex hormones tayo like testosterone and our estrogen in the body. Meron yan silang mineralocorticoidal action kasi itong mga sex hormones natin, they are also considered steroids. They are also considered as steroids, but their action also have this mineralocorticoidal action, which is again the salt and water retention. Now, yung marami sa market is yung glucocorticoids. It's not just in the market but also in our body. So example here, our hydrocortisone. Okay, so kasama niyan dyan yung iba, yung mga prednisone, prednisolone. Nandyan yan siya sa body natin, but yes, we do have drugs na like this in the market. So ito yung may action sa different cells in the body, most especially metabolism, like glucose metabolism, that is why it is called glucocorticoids. Fat metabolism also is included here. And ito yung may function din in inflammation and immune system or yung mga white blood cell actions natin in the body. Okay, so that's how we differentiate mineralocorticoids and glucocorticoids, which are the two types of corticosteroids inside our body. Did I clarify that? Or you still
Yes,
have
ma'am.
questions? Kasali na dyan ha yung mga available natin na corticosteroids na tinatawag in the market. Dito yan sa glucocorticoids, ma-under. Prednisone, prednisone, betamethasone, what else? Yan, hydrocortisone. Aray, kito. Wala na. Sige. So, ulitin ko, draw yung aking eicosanoid pathway kanina ha. By the way, nag-discuss kayo nito sa Pharmacology 1. Hindi ko kasi alam ano yung natapos niyo sa Pharmacology 1, ano yung hindi niyo na-discuss. Ang alam ko lang talaga, when you say PICOL 1, you talked about Simpa and Parasimpa. And I am expecting that you are done with the CNS drugs. So when I say CNS drugs, that include our CNS stimulants, our CNS depressants, yung mga antidepressants, sedative hypnotics, yung mga anti-seizure drugs, yung mga drugs natin for neurodegenerative disorders like Parkinson's disease and Alzheimer's disease, yung mga ALS, ano, meaning na ALS, makalimutan ko tuloy. Ano pa? Ang dinidiscuss dyan. Anti-seizure, anti-psychotic. Are you done with those things? Kasi I would like to supplement that one after the anti-cancer drugs. If meron kayong hindi natapos sa PICOL 1, let's discuss that one, ha? Sa laboratory. Okay? Okay. Hindi na naman mag-agi ako on. For this one is this is why my memory function. What shall I do? So it's working. Okay. Ayan na siya. Sige. Oh. No. Okay. Let's talk about the eicosanoid pathway again. What was the start of the eicosanoid pathway a while ago? We talk about the stimuli. The stimuli class can be allergens. So the person may be exposed to certain allergens, causing allergies and inflammation. And then if the person gets injured, masamad ka or whatever, basta there is injury, that will trigger the phospholipid. Let's start with the diacylglycerol or the phospholipids. Itong dalawa are found in our cell membranes. Okay? Again, these are found in our cell membrane. So kapag matrigger silang dalawa, magre-release yan sila ng arachidonic acid. So arachidonic acid is a 20-membered fatty acid in the body. Again, 20-membered carbon pala. 20 carbon na fatty acid in the body with 4 double bonds. Ayan yung marirelease. And this one is a board exam question kasi ina-ask ito ano yung parang raw material for us to make the prostaglandins. It's the arachidonic acid. Now, this arachidonic acid will be acted upon by 2 enzymes. The first one is The first one is cyclooxygenase. We abbreviate this as COX. And then the other one is the lipoxygenase. And we call this as the LOX. But before I forget, the arachidonic acid class will be released if there is an action of the enzyme phospholipase in the phospholipid or the diacylglycerol found in our cell membrane. So it can be phospholipase C or phospholipase A2. Okay? So again, the most important things lang dito ang ilalagay. It's not lipoxin pala. I would like to correct. Lipoxin ata ang sinulat ko kanina. But nevertheless, let's start with the prostaglandin. And then we have here the thromboxane. And before I forget, it's not lipoxin. Lipoxin should be here together with the leukotriene. It's prostacyclin pala. Forgot this morning. Okay? So yan yung mga marirelease depending on what enzyme acts on the arachidonic acid. So the first one there, let's concentrate first sa cyclooxygenase. The first one here is the prostaglandin, which is responsible in the formation of inflammation in that area in the body wherein you have the stimulus or the stimuli pag marami. And prostaglandin also recruits white blood cells to go to that site of injury or site of action and work, syempre their function, and that will still lead to the formation of inflammation. Okay? Let's not talk about epoxygenase first. Let's just have cyclooxygenase and lipoxygenase. And then that is also true for prostacyclin. This has something to do with inflammation also. But for thromboxane, sinulat ko 'di ba kanina, this is responsible for platelet aggregation. Though it has also a work in the prostaglandin side, like formation of inflammation, but its work is more on the platelet aggregation. Okay? And leukotriene on the other side, produced when lipoxygenase takes its action to arachidonic acid, as well as lipoxin. These two have bronchoconstricting activity. Okay? So you know that if there is bronchoconstriction, there will be narrowing of airways and that the patient will have difficulty in breathing. Okay? Now, let's talk about the drugs that act on this eicosanoid pathway. We call this eicosanoid pathway, huh? Okay? So the first drug I wrote this morning was corticosteroid or corticosteroids. All of them class act on this part of the pathway, whether it is hydrocortisone, betamethasone, prednisolone, whatever. Okay? So, they will inhibit phospholipase C or phospholipase A2, and that will result to the inhibition of the release of arachidonic acid. And if there is no arachidonic acid class, there will be no prostaglandins and the other chemicals there that can cause inflammation. So that is the reason why corticosteroids are also considered anti-inflammatory. And remember, I told you a while ago that prostaglandins can recruit white blood cells to move to the site of action or to the site of injury for them to do their functions. So when you inhibit the formation or release of this prostaglandin, you also inhibit the recruitment of the white blood cells, the function of the white blood cells in the immune system. And that is the reason why, aside from being an anti-inflammatory, corticosteroids are also considered as immunosuppressant. So like in the case of transplantation, the patient will be given corticosteroid para to prevent his or her body to reject the newly transplanted organ. Kasi the cause why the body rejects that is the work of the immune system. Kasi the newly transplanted organ is considered non-self. Okay? Hindi siya self talaga na part of the body. So it might be rejected, though it's the same, like it's the same kidneys pa rin yung nilagay dyan, pero non-self kasi siya. Kaya the possibility of rejection is also high. So that is why we give immunosuppressant drugs. Huh? Yeah, before ma-produce ang arachidonic acid, we need the action of both phospholipase C and phospholipase A2 doon sa phospholipids and sa diacylglycerol in the cell membrane. And the one that causes that action is the stimulus. Okay? Sige. Now, aside from that, corticosteroids are also used for asthma. Why? Because again, you have a part in this pathway with this enzyme, lipoxygenase, leading to the production of leukotrienes. So leukotrienes class are very well-known bronchoconstrictors in the body. Okay, our body produce this substances. Leukotrienes. Marami kasi yan silang types ng leukotrienes, but nevertheless, they are bronchoconstrictors. So if you inhibit the formation of leukotrienes in the body, then you are also inhibiting bronchoconstriction. Again, that will explain why corticosteroids are also used for asthma. Okay? So maraming trabaho si corticosteroids class. Pero sadly, kahit marami siyang work, marami siyang effect in the body, some of that will be unwanted. Meaning, we don't want those effects and that will be called now adverse effects. Medyo marami din, mahaba din ang listahan, and that limits the consumption of corticosteroids. Do you have questions about that? Wala. Sige. So, dito naman sa cyclooxygenase, let's write NSAIDs. I believe you are very familiar with our NSAIDs, non-steroidal anti-inflammatory drugs. Give me examples of NSAIDs class. Let's have our participation this afternoon. Okay? Sige, before I'll continue, ibuprofen tayo. So pa. Ibuprofen. Yeah. Ibuprofen, tananin yung answer. Diclofenac is correct. Diclofenac, how we have diclofenac sodium and diclofenac potassium in the market. You have to know which one is potassium, which one is sodium. I think the sodium is Voltaren. I forgot the potassium. It's Cataflam. Cataflam is the diclofenac potassium. Okay? Yeah, mefenamic acid is considered an NSAID, but actually, ganito class ha, yung mefenamic acid natin though it is considered NSAID, pero the dose that we are using nowadays is just actually an analgesic. So, hindi talaga siya anti-inflammatory. Like, example, masakit ang ngipin mo, you may administer or you may take mefenamic acid. It will cure the pain, it will relieve the pain, but it has nothing to do with the inflammation. Yan yung mefenamic acid na ginagamit natin ngayon. Okay? Sige. Aspirin is also included, our ASA, or anong meaning ng ASA? Acetyl salicylic acid. And yes, naproxen is also included here. Aspirin, naproxen. Yeah, the coxibs also are included here. The celecoxib, the etoricoxib, kasama siya dyan. Else, wala na. Yeah, ketorolac is also included here. Though among the drugs you have mentioned, ketorolac is mostly used parenterally. Yeah, piroxicam is also included. That's the brand name of piroxicam. Feldin, no? Kindly check. I think it's Feldin. Feldin yung sa piroxicam. Oxaprozin, though, it's not really a common drug. Okay? Sige. Pero, ganito ha. Si Cox kasi, meron kasi tayong dalawang Cox. Cox 1 and Cox 2. Yung mga binanggit ninyo, most of them are non-selective, meaning they can both inhibit COX-1 and COX-2. Si COX-1 kasi, ang tawag kasi natin dito, good COX. Kasi it will not produce prostaglandins that will be a problem sa inflammation. Kasi kahit yung prostaglandin class, kailangan din natin siya in the body. We actually need prostaglandin for our heart to function well. So yan yung mga prostaglandin na nire-release kapag ang enzyme na nag-act on the arachidonic acid is the good COX or the COX-1. Okay? So itong COX-2, yan yung tinatawag natin na bad COX kasi ito yung nagre-release talaga ng prostaglandins na responsible for inflammation. Okay? So ano yung mga yung mga selective sa COX-2? Yun yung mga nag-end sa COXib. Okay? Again, yun yung mga nag-end sa COXib class. Yung selective sa COX-2. Actually, the COXibs are considered cyclooxygenase 2 selective inhibitors. The rest class are non-selective, which means that they can inhibit both the good COX and the bad COX. But nevertheless, they are still anti-inflammatory. What is the better option for inflammation aside sa mefenamic acid? You can use the other NSAIDs. You can use the other NSAIDs. You can use, actually, the ibuprofen, I think, is yung dose din na kinoconsume natin nowadays, nasa level pa lang siya na analgesic siya. Kasi mga NSAIDs natin, aside from they are being anti-inflammatory agents, they are also analgesics, and some of them are also antipyretics. So they have the ability also to lower our body temperature, and they have also the ability to relieve pain. But yung for mefenamic acid and ibuprofen, the lower doses of these drugs are just considered analgesic, but they are not anti-inflammatory. So you may choose other options na kasali pa rin sa NSAIDs if you have inflammatory conditions in the body. Okay? But pag masakit ang ulo nyo, okay lang naman yun siya. If you don't want to administer or to take paracetamol, which is actually safer compared to these drugs, you can do that. Our problem with our NSAIDs, most of them are acid derivatives. Actually, that's why they end with AC, no? Like the clofenac, ketorolac. They are actually acetic acid derivatives. So most likely they are acidic. And if you don't eat before taking them, syempre, you will experience hyperacidity. And yung iba talaga, if they take these drugs chronically, then they may have ulcers. Yan yung problema talaga natin sa NSAID. So if you're going to dispense them, you have to remind your patient or your customer to really eat, ha? Unlike paracetamol, kasi paracetamol is considered safe. Even if you don't eat class, paracetamol is okay. It does not cause hyperacidity. So ito yung better option if the person, kasi pag may sakit ang person, wala talaga siyang gana kumain. Yung better option natin dyan, paracetamol. Yeah. Thank you for raising that. Before I forget, our NSAIDs class, the higher doses of our NSAIDs are RX. What do you mean by that? They have RX in their labels, and that means they are prescription drugs. The mefenamic acid 500 milligram is a prescription drug. The higher dose of the ibuprofen is also a prescription drug. What is the over-the-counter? The lower doses of this NSAIDs. So the mefenamic 250 milligrams. However, isang malaking however, siya ato ang problema. Kasi the mefenamic acid, pinaka-example talaga, the mefenamic acid has become an OTC in the Philippines. Pero, based na sa age. No, it's not based sa age class. Our doses sa mga drugs natin are based sa body weight. Body weight talaga tayo, ha? Kapag malaki ang patient natin, talagang malaki din yung dose niyan. Hindi siya necessarily 250 milligrams sa bata. Though yes, maliit talaga ang bata na when it comes to the body weight. Pero it's not necessarily sa bata. You can also give the 250 milligrams to adults. So our problem nowadays is masakitan siya og ngipon, diretso dayon 500 milligrams, which in fact, kailangan muna ng reseta yan. Marami tayong practices in the Philippines na hindi talaga tama. Hindi talaga tayo sumusunod. Okay? That is also true for the naproxen. Naproxen 550 is a prescription drug. The 275 is an over-the-counter drug, and it is not based sa age. It is based on the patient's condition. Remember, class, pain is subjective. Subjective ang pain, ha? Kaya kapag na-hospital kayo, ina-ask kayo, you have to rate the pain from 1 to 10. If sabi nyo 10, then sa iyo, it's 10. It's very masakit. Though yung sa iba na nakatingin sa inyo, murag feeling nila nga, murag may ra kaayo ang imuhang na feel, pero sa iyo kasi 10 na yun siya. So pain is subjective. So drug na ibibigay natin is again dependent on the patient's condition and at the same time the body weight. Okay? Paano naman yung bata na malaki? Tapos severe pain. Not really severe pain because severe pain are caused by example cancer, ganon. May moderate pain lang. We use the NSAIDs class for moderate pain, for inflammation. We don't give NSAIDs to severe pain. Ha? Nasabdan? Do you have questions? Most of these class are given 3 times a day. And then I think I have mentioned the naproxen. We use the naproxen test to diagnose cancer also. Di ba na-mention ko yan, no? Yung that is just an initial testing, ha. Hindi yan siya confirmatory kasi we don't know saang part yung may cancer. But if a person has fever and then you have used all these NSAIDs starting from paracetamol, but paracetamol is not an NSAID. It don't have anti-inflammatory activity. And then you have used the other NSAIDs also like aspirin, like ibuprofen, pero pag hindi natablan ang patient, tapos gumamit ka ng naproxen, tapos biglang natablan siya ng naproxen, bumaba ang kanyang body temperature, ayan na yung you may have cancer. Okay? So again, we call that the naproxen test. Okay? So again, ha, paracetamol is not an NSAID. It's just paracetamol. It has anti-inflammatory and analgesic activity, but it is not an NSAID. Non-steroidal anti-inflammatory drug. We really have to give emphasis to non-steroidal kasi most of our anti-inflammatory drugs are steroidal. Remember our corticosteroids. Okay, how do you know if it is a steroid? This is a board exam question. Ito yung merong CPPP nucleus. Ano ibig sabihin ng CPPP nucleus? Cyclopentano perhydrophenanthrene. Ay, lubat sa word. Ibot tayo na panggain. Wait. May raise. Ay, phenanthrene. Okay? So yan yung ano ha. If you are asked, how do you know if a substance is a steroid? When you look at the chemical structure of the drug, it has to have the CPP nucleus or the cyclopentano perhydrophenanthrene. It looks like this. It's a 4-membered ring. Dalawang benzene ring na magkatabi. Tapos, merong isa dito sa taas. Tapos, merong 5-membered ring nakasama. Yan yung mukha class ng cyclopentano perhydrophenanthrene. So walang ganyan ang mga NSAIDs, ha? So they are not steroids. They are not steroidal. Okay? Now, what else? Let us NSAIDs. Aspirin is included sa NSAIDs, ha, but it has a special action here. Aspirin class has the ability to inhibit thromboxane, and that will lead to the inhibition of platelet aggregation para walang blood clot. Okay? So that will explain now why aspirin is given to patients with cardiovascular disorders. Like if a person has hypertension or heart failure, I don't know if you have observed in the community, actually it's a misconception in the community that aspirin is an anti-hypertensive drug. Kasi most of the time, these people with cardiovascular disorders are given one. Okay? Misconception yun siya sa community. Pero, aspirin is never an anti-hypertensive agent. It's not a drug for heart failure. It's not a drug for arrhythmia or angina. But aspirin is still an NSAID, a non-steroidal anti-inflammatory drug, but because of its inhibiting activity sa thromboxane, it can be given to those conditions para walang platelet aggregation. Kasi syempre kapag may platelet aggregation, magkumpul-kumpul yan siya, mag-cause yan siya ng blood clot. And then, di ba, dyan magsa-start yung mga stroke, di ba? Kapag example, the blood clot class is nasa brain, mas-stroke ang patient. Kung nasa coronary arteries siya, the patient may experience myocardial infarction or heart attack. Kasi because of the blood clot, syempre, ma-obstruct yung blood flow. And pag walang blood flow, walang oxygen, mamamatay yung heart cells. Okay? So yan yung reason lang talaga why we give aspirin to patients with cardiovascular disorders. I hope nasabtan to siya. But another thing that you need to know is aspirin is only a platelet aggregation inhibitor at its lower dose. So yung mga aspilet easy na yan, if you look at the dose, it's 80 milligrams. That's the anti-platelet na aspirin. Okay? Anti-platelet yan siya. Lower dose. Yung mga aspirin na nakikita nyo, like Bayer aspirin na umaabot ng 300 milligrams, ayan na yung NSAID. Okay? NSAID yun. So, analgesic, antipyretic, and anti-inflammatory. 300 milligrams. Yung sa Bayer. Kasi dati yung Portal, aspirin yun siya. Kaya lang, di ba, the community was using that as an abortive patient. Sumikat yan si Portal dati pampalaglag. And they have reformulated their Cortal. Cortal is still Cortal, but the generic name now is paracetamol. Okay? What do you need to know about aspirin then? Aspirin should not be given to children. Okay? Hindi siya pwedeng ibigay sa children as antipyretic. Bakit? Ano man. Kasi class, kapag ang bata ay may viral infection, tapos naglagnat siya, tapos binigyan mo siya ng aspirin, the child may experience Ray's syndrome. Okay? So what is Ray's syndrome? Daot iyahang liver. Ano siya ang target? It's the liver. So please do not give aspirin to children. If merong bata na nilalagnat, the safest drug will always be paracetamol. Except if ang bata na yan ay allergic to paracetamol. Kasi meron talagang bata na allergic to that. Gahatag og aspirin kay para daw sa lagnat. Yeah, you can give aspirin sa nailagnat. The higher dose ha, the 300 milligrams. Do not give the aspirin easy. Example, naglagnat ka, okay, sakit kayo mong ulo, nakakita kag aspirin, inom kag aspirin, wala dyan nahitabong effect anak class nga analgesic ha, kay lower dose man to, anti-platelet lang siya. So if you want to take aspirin para sa imong lagnat or para sa imong pain, asa man kapita diha pain, use the higher dose. Unsa daw ka ugtas na dito. Naugtas man ka. Ang uban mag-take og proton pump inhibitor jud ilang gina-take as in PPI. Ano ba? Kasi aspirin, remember, is acetylsalicylic acid. Diba? We draw the structure of aspirin. Looks like this. Ano nga yan? CH3. Acetyl. So, dalawang carbon yan, no? Acetyl salicylic acid. This is the salicylic acid. This is, yeah. Dalawang carbon. Let me check. Pakadalawang CH3. So, daning gugay na tawala ng good low farm chemical. Cannot remember the mali. Wait lang. Itama natin. Dalawang carbon talaga. May carbon ka dyan, double bond O, and CH3. Okay? This is the structure of our aspirin. That is why it is called acetyl. Kaya ano acetyl? Duha ka carbon gani. Acetyl, duha ka carbon, and then we have here the salicylic acid. Kasi remember, the salicylic acid looks like this. This is a benzene ring, ha, gitamad na og sulat sa double bond. And then this one. So this is the salicylic acid. And then nilagyan lang natin siya ng acetyl group. That is why it is called acetylsalicylic acid. So since this is acidic, it can cause hyperacidity sa patient. Siguro that is the reason why they administer proton pump inhibitors. So what are the examples of our proton pump inhibitors? Yung mga prazole natin, omeprazole, pantoprazole, esomeprazole. These are drugs for hyperacidity, for GERD, and for ulcers. Siguro that is the reason. It will just become necessary if you are very sensitive to the acidity of aspirin. Pero if you are not sensitive to the acidity of aspirin and then you eat before taking the aspirin, hindi siya necessary. Ha? Aspilet easy ilang ginahatag kay para sa lagnat. You just inform them ha na the dose for the Aspilet EC is very low for it to become an analgesic or antipyretic. Advise them to use the higher dose. Yeah, OTC. OTC? Let's see. Yun. Isa ba ang nakasulat sa sudlanan sa aspirin? May, ay, may ano ba? May RX? Walang RX. Ay, may RX. Yeah, it's ano, it's a prescription drug. May RX pala. Yeah, it's it's a prescription drug. May RX pala yung Aspilet EC. RX yun. May ano yun. May prescription dapat yun. Omeprazole. Yeah, ito yun sa tanong ko yun, no? Sa PPI. Yeah, omeprazole. Klaro naka. Klaro na kayo sa box. Bugay na dumiwa nagkitaan ng Aspilet EC. Kaya sino kabutang. Anti-thrombotic. Yeah. You educate them. That's your work there sa pharmacy. As you learn, you also educate the people there in the community, ha? Kasi wala kasi problema sa hospital kasi makaharap niyo sa hospital, mostly mga nurses, mostly mga doctors. Though they don't know everything, but still, they know a lot about medicine. So, it's not really a problem. But sa community, din ha, yun na yung problema. Tapos, ang mga PA pa dyan na to, they are not really graduates of pharmacy assistant. Kasi di ba may course na pharmacy assistant? Yung 2 years lang, they are not graduates of that. So, some of them, actually, itong nag-work ko sa pharmacy, may kasama akong graduate ng IT, graduate ng education. Wala dyan sila background. So, siguro kung ano yung narinig nila, yun yung sinusunod nila. Dili sila mo to sa inyo. Dili mo katuhan. Sige, ganito, pawi kayo pag pharmacist na kayo, ha. Kasi mahirap talaga kapag ka student. Syempre, parang may hierarchy kasi, no? Kanang like thinking na you are a student, ganon. Siguro that's the reason why they don't believe you. So, bawi mo pag pharmacist na mo. Tarungan yun din yung nag-eskwela, tapos tarungan yun yung board exam para na may lisensya po kon. Kana, mutuog yun na sila sa inyo. And then, you start in your family. You educate your family first about the proper use of drugs para they will be safe also, and at the same time we can achieve the maximum or the optimum effect of these drugs sa kanila. You start with your family, and then after that tuloy-tuloy na yan siya with your relatives also, and then if you will become registered pharmacist pohon, ayun, you will have a lot of people to educate. Okay? Anything else? Wala na? So that's for the the NSAIDs. Let's erase this one. Kasi dito na naman tayo sa lipoxygenase. Sige. So, si LOX, again, leukotriene yung kanyang ini-inhibit. So, si leukotriene, meron tayong LOX inhibitor. I forgot the name na naman. Ay, ayan na. Lagutan ang makalimutan. Meron tayong nag-i-inhibit kay lipoxygenase, and that is the Zileuton. Hindi ako nakakita ng Zileuton. Yung experience ko lang kasi talaga, no, is my internship nung kagaya sa inyo, community pharmacy, and then yung 3 months ko sa Rose Pharmacy. So I don't really see a lot of drugs, including the Zileuton. But I know that Zileuton exists, and I know its action in the body. It's a lipoxygenase inhibitor so that there will be no leukotriene. So most likely this is used for asthma. Para walang bronchoconstriction. Zyflow. Yeah, Zyflow. Pero ako kita sa ano. Sa Rose naman pag ko nag-work sa una. Okay, lipoxygenase na siya. Pero dito, class, sa leukotriene, we have leukotriene receptor inhibitors. Kasi when leukotrienes are released, they have to bind first in their receptors for them to elicit their action, their bronchoconstriction na action. So ito yung mga nag-end sa Leucas. Okay, so just like the Montelukast, what else? What else? Montelukast lang tanan. So pa, we have the Zafir Lucas. Mga nag-end sa Lucas class. Okay? Very good. Sige. So again ha, let's call them leukotriene receptor inhibitors. Yeah, Zycast I think is a brand name. No? Brand name na siya. Pero it's a combination drug. Zycast is a combination of Montelukast and levocetirizine. So, syempre, levocetirizine is an antihistamine. Okay? So, aside from, ganito kasi siya, si Montelukast, syempre, inhibit niya si leukotriene para walang bronchoconstriction. So, it can help you if you have asthma para hindi mag-narrow yung airways mo, makaginhawa ka o tarong. And at the same time, pinartner na siya with levocetirizine kasi one of the triggering factor of asthma are the allergens, right? Kasama si histamine doon sa mast cell degranulation, di ba, na mare-release. And at the same time, histamine itself can cause bronchoconstriction. So we may prevent that also. We may inhibit that using the drugs. Okay? Do you have questions with the whole eicosanoid pathway or the drugs included here? Or may gusto kayong itanong? Actually, ano man, enjoy man mag-learn of pharmacology. So, diretso ng exam. Lisod lang siya ng exam. Kaya siya. If you want to be a doctor, if you want to pursue medicine class, pag pharmacist kasi kayo, hindi kayo mahihirapan nito sa med proper. Kasi some of the medical students, nahihirapan sila sa pharmacology during during sa kanilang medicine proper. Yeah, basta na sila classmate na pharmacist, ingnon ba din na nila nga, ikaw kabaluan ni kay pharmacist di ka, naon din na nila. Parang sa mga medical technologies, tinanggal sa kanila. May pharmacology dati ang medtech. Ngayon parang tinanggal sa curriculum nila. Tapos, yung mga nursing, meron din yan silang pharmacology, but I don't teach pharmacology sa nursing. Magkamang sila kung ako ilang maestra. And my approach will be just like sa inyong pang board exam. Asa na ga ito? Diri natanong corticosteroids. Ito yung mga examples ng corticosteroids natin ha, na pwede for asthma. And we have different types of dosage forms for this. But then again, ano sabi ko, the aerosol treatment is the most effective way for us to avoid systemic adverse effects. Kasi pag ininom mo siya orally or nag-inject ka ng corticosteroid, syempre mapupunta siya sa blood and it will go through your body because it will be distributed by the blood and yan yung magkakaroon ka ng mga adverse effects. So we have here examples, no? We have beclomethasone na ginagamit inhalational. The 4 puffs twice a day of our beclomethasone, the dose is 400 micrograms per puff niyan, is equivalent to 10 to 15 milligrams per day of oral prednisone. So, ang problema kapag do parehas lang sila ng activity ng prednisone and the beclomethasone at this certain dose, again, ang problema natin pag nag-oral tayo, yung systemic adverse effects. So, for asthma, this one is the best option. Okay? Now, ano ba yung sinasabi ko na adverse effects of our corticosteroids? Itong oropharyngeal candidiasis, para ito sa mga inhalational ha. Kasi asa man din na nila ginapuff, di ba, sa baba. Now, ganito yon. You advise your patients also ha, kapag ka may bumibili sa inyo ng corticosteroid na pinapuff sa bunganga. You advise them to always gargle. They always have to gargle water and spit the water syempre after treatment. Dili tulunon ha. Gargle and then you spit the water after gargling. Now, bakit? Kasi remember, corticosteroids are considered immunosuppressant. So, in that part, sa mouth natin, sa agianan dinhi, kapag ka merong corticosteroid, nasusuppress yung immune system in those area. And remember, Candida, which is a fungus, lives also there. Meron tayong fungus dyan, the Candida. Aside sa mga babae in our vagina, merong Candida doon. Meron din yan sa bunganga. Na actually, di ba, nagpo-cause yan siya ng singaw. Pero since there is immunosuppressing action in that area because of the corticosteroid, ma-overpower ni Candida albicans. I don't know how you pronounce that, but I pronounce that as Candida albicans or albicans, whatever. Ano yan siya, ma-overpower niya yung immune system mo. Kaya magkakaroon ng candidiasis. Okay? In that area. So please do not forget to inform your patient or your customer to gargle every time ha na mag-puff siya. Wait lang ha. Pyrotin, permethrin. Okay. Now, aside from that, it can cause hoarseness. Kasi syempre, di ba, pag nagpa-puff in that area, there will be hoarseness sa voice mo. Pero ito yung mga systemic adverse effects. It can cause osteoporosis. The corticosteroids class can make your bones brittle. So, be careful with that also. Yung mga asthmatic dyan na parating nagpo-corticosteroid is actually at risk of having osteoporosis and at the same time cataract, and at the same time we have adrenal suppression. Ito na yung mostly sa oral na medication. And mas suppress yung adrenal cortex natin. Kasi di ba sabi ko kanina, itong corticosteroids are released in the adrenal cortex of the adrenal medulla. So kapag marami kang corticosteroids inside the body, that will send like a feedback sa brain, and then yung brain mo, a message to the adrenal medulla not to release corticosteroids anymore kasi marami ka naman in your body from the outside source, yung sa ininom mo na gamot. So, masuppress yung adrenal medulla. And it can also cause stunted growth. So, muna siya ang mga, if you have observed, hindi naman lahat, pero marami sa mga asthmatic class, sila, yung maliliit. Kasi one thing is, corticosteroids can cause stunted growth, but though it is not really that proven, kailangan pa talagang i-prove. Pero asthma itself kasi can delay puberty. Okay? So, mostly sa mga asthmatic, maliliit. both yan siya, oral and kung ini-inject, kasama na doon. Pero itong oropharyngeal candidiasis, and then even itong hoarseness of voice, ito yung sa mga inhaled corticosteroid. The rest, na yan? Sa oral. And then, let us include also, was not able to include it or naas sa next one? Wala dyan. Dagdag natin dito yung hyperglycemia. Corticosteroid class can cause hyperglycemia. Remember, the glucocorticoids are kanang included sa function nila yung metabolism. Okay? So, mag-cause yan siya ng hyperglycemia. So, be careful sa pag-inom aning corticosteroid na gamay nga hubag corticosteroid, allergy na corticosteroid na sad, gihubak na corticosteroid na sad. Medyo delix. hindi siya safe drug yung mga corticosteroids natin. So be careful. We have another drug here. Nandito ata siya. Yeah, hindi na siya sa list. Cyclesonide is a prodrug, and then ang active metabolite niya is mataas yung kanyang protein binding. Diba, you have that in your biopharmaceutics. Yung one problem natin or one thing that we need to consider in the distribution of the drug is the protein binding. So itong cyclesonide is one example of the drug that has a high level of protein binding. And since mag-bind siya sa protein, malaki kasi ang protein. So hindi yan siya basta-bastang nakaka-pass through sa mga cell membrane. And yung kanyang consequence is hindi siya basta-bastang nagkakaroon ng access sa glucocorticoid receptor sa skin, sa eyes, and sa bones. So ang result niyan, ito yung parang corticosteroids na lesser yung risk sa osteoporosis or yung sa cataract. Yan. Corticosteroids does not really increase appetite. Oh, by the way, before I forget, let's also add fluid retention here. Sa side effect ha. Merong mga tao na ginagamit nilang corticosteroid as vitamins. I always say this sa Facebook. Tapos binibenta din siya sa Shopee. And then I can still remember I've seen this one sa public market sa palengke. A corticosteroid, I don't remember if it is prednisone, but it is a prednisone that is smuggled from the other country. I think if it's not from Malaysia, it's from Indonesia. Binabackdoor nila tapos hinibenta nila sa public market in a cheap price, and they market that one as a vitamins pampatambok. Dili na siya tinuod. Dili na siya tinuod. Dili na siya tinuod. Kano sa manahimog pampatambok ang corticosteroid. But yes, pwede kang lumobo pero hindi ka tumaba. Nag-edema ka. Okay? Kasi corticosteroids can cause fluid retention. So, hindi mo na basta-bastang na-excrete ang fluid mo inside the body. It will be accumulated and you will mistaken that one as nagtambok ka. You will mistook that one as nagtambok ka. Okay? So, dili na siya pang pa-increase of appetite. And if you see this one happening in the community, please educate them also. Kasi nagatugod yun sila na nagatambok sila pero nagahupong lang dahil sila. Tingnan sila, itry nila gundang inom ka ng ilahang vitamins. Diba mukalit sila kahuyos? Mukalit sila kahuyos. Nga naman, kay na-excrete na nila yung water. Kasi pinipigilan yan siya ng corticosteroids. So, like I know someone na nag-overdose. Na-overdose siya ng kanyang corticosteroid kasi asthmatic siya. Tapos parang I think because of his asthma, nag-inhaled corticosteroid siya, at the same time binigyan pa siya ng doctor ng oral corticosteroid. So ang ending, nidako siya. And then we mistook that one as nitambok. Pero when another doctor saw him, nakurat jud ang doktor, kailangan na unsa na daw nga hupong na siya kaayo. Tapos pag like, alam mo kasi pag nag-edema class, hindi kasi talaga fats ang laman, dili parehas ani. Fats tanan ang sulod. If gunita ninyo ako ang kamot, fats jud na siya. Pag ano kasi, pag naghupong, water kasi ang laman. Humo kayo na. Then you can really feel the water inside. Ano sila nagtambok? Okay? I hope I have clarified that. Anything else? Wala na. Sige. So, wait lang, checking the time. Okay, so we have here mast cell stabilizers. These are also drugs for asthma. Again, we call them mast cell stabilizers. We have examples here, dalawa, the cromolyn and the nedocromil. And both of them, just like our other drugs for asthma, they are also given inhalationally. So, paano sila nakaka-help sa person with the asthma? Their action is on the chloride channels. Okay? Mag-a-act sila on the chloride channels in the cell membrane of the mast cell, and then i-inhibit nila yung pag-activate ng cell membrane na yan. And kapag hindi na-activate kasi, hindi siya mag-degranulate. So, hindi siya magre-release ng mga inflammatory na mga chemicals inside. So if balikan natin siya konti, yung pathophysiology, ayan. Itong pathophysiology of asthma, di ba remember, because of the antigen, there is the action of IgE on the B cell, and B cell on the mast cells. So ito, ang mast cells class, kapag nasira yung membrane nito, mare-release yung mga granules inside. And ano yung mga granules na yan? Histamines, leukotrienes, mga other pa na mga pro-inflammatory cytokines, mga interleukin, lahat sila mag-lead into inflammation and at the same time bronchospasm. Okay, so asthma lahat yan ang mangyayari. Na pag binigyan mo ang person ng mast cell degranulator, ang activity niyan is ipapastabilize ang membrane ng mast cell, pastabilize ha, inhibit yung chloride channel para hindi siya ma-activate, hindi siya magre-release ng mga chemicals na yan. So, kaya anong tawag natin sa drugs na ito? Mast cell, asa na yun? Sobraan. Mast cell stabilizers. Again, examples, cromolyn and nedocromil. So, ginagamit sila for non-seasonal asthma and allergic rhinoconjunctivitis. Parehas sa akong condition. I have this one, allergic rhinoconjunctivitis. Kasi di ba I have rhinitis. Pag maka-inhale kasi ako ng like allergen or mostly pag mata sa buntag, kung bugnaw ang panahon, trigger na po ang rhinitis ani. Sige na po pangatching. And at the same time, kapag kasama na yung mata kasi, di ba, mamumula na yung mata, ano na yon, sign na talaga ng allergic conjunctivitis. You can use also nedocromil and cromolyn since they are mast cell stabilizers. They will inhibit the release of histamine also para hindi na maggrabe pa ang allergy. Okay? Pero what are the side effects of these two? IgE antibody, hindi din. Hindi siya pwedeng tawagin. Ang IgE kasi, di ba, ano yan? Wait lang, asan na to? Balik. Okay. Si IgE, di ba, is an immunoglobulin. So, mag-activate yan siya ng B cells. Before mo siya tawaging IgE antibody, dapat ang action niya is on the IgE mismo. Pero si mast cell stabilizers kasi doon talaga sila sa cell membrane ng cell na ito magte-take ng action. So it has nothing to do with the IgE. So hindi mo siya pwede tawaging IgE antibody. Okay? Sige, saan na yun? Side effects, we have here throat irritation, common activity of our mast cell mast cell stabilizer niya, degranulators. Mouth dryness, chest tightness, wheezing, and then we have the dermatitis. The myositis is on the muscles, inflammation of the muscles, muscle tissues, muscles mismo, and then we have the gastroenteritis. So ito naman yung list ng side effects niyan. Okay? Now, nasabi ko na ito sa inyo kanina, the leukotriene prevent bronchospasmia. Sa leukotriene pathway inhibitors, itong LTB, LTC, LTB4, ito yung mga types of leukotriene. So, di ba sabi ko kanina, marami masyadong types ng leukotriene. So, si LTB4 is a potent neutrophil chemoattractant. What do you mean by that? When leukotriene B4 or LTB4 is released, it will recruit class than neutrophils. Diba? Neutrophil is one type of white blood cells. I-attract niya si neutrophils, magdali diri neutrophils kay mag-take action ani nga side. And then pag nasi neutrophil, syempre, you know that our white blood cells attack kung ano man yung ang nandoon. And when it attacks the substance causing your allergy or causing your asthma, kana nga part will have inflammation. So, musamot ang airway narrowing. So, si LTC and LTB4, direct sila na magkukos talaga ng bronchoconstriction. So, magiging hypersensitive or reactive yung ating bronchial smooth muscles. And it will also trigger edema and mucus production. Musamot og gamay ang airways because of that. Kasi there will be like accumulation of water in that area and at the same time accumulation of the mucus. So yan yung examples of the leukotrienes and ano yung trabaho nila leading to asthma. That is the reason why we inhibit them. I've mentioned the zileuton a while ago. It is a lipoxygenase inhibitor para hindi ma-release si leukotriene. Pero pag na-release na si leukotriene, let's inhibit its action in the receptors. Okay? And we have here the Zapir-Lucas and the Montelukast. This is not singular. Singular yan. Bakit yan? Ano man na? Singular, diba? Okay? So, how about the side effects? For zileuton, medyo may problem tayo sa kanya in the liver. And it can cause Hirsch-Strauss syndrome also. Ano yung sabi ko si Zycast kanina? Combination drug siya, no? Montelukast and levocetirizine. So, combination drug ang Zycast. Okay, so si Hirsch-Strauss syndrome is a systemic vasculitis accompanied by worsening asthma. It can also cause pulmonary infiltrates and eosinophilia. Yan yung na-cause ng mga lipoxygenase pathway inhibitor natin. When you say vasculitis, ano yan siya? Itis means inflammation. Okay? Inflammation of the what? Tama siya nga inflammation. Before ta mag-break, kay it's 2:54. Kailangan natin mag-break basig information overload. Naduguro ba itong next nga topic? Yeah, inflammation of the blood vessel. So, nag-inflame ang blood vessel class in that area wait lang, sa bronchioles. So, mag-lead to siya sa ang mga white blood cells magstay on that area, attacking that part of your body And mag-worsen yung asthma mo. Kasi mag-worsen man din ang inflammation yan. Aside sa nag-inflame na nga yung white blood cells, yung blood vessels mismo. So, pwede yan siya mangyari with our leukotriene pathway inhibitors. And then we have other drugs for asthma. Mauni siya ang gina-ask ni Pauline Gaina. Kung naabay ingana, yes na ay ingana, na the action is direct to IgE. We call that anti-IgE monoclonal antibodies. In the form of the drug is called omalizumab. Actually, you can identify yung mga monoclonal antibodies natin kay ang ilahang names most of the time nag-end sa AB, antibodies. Omalizumab. Okay? So anong trabaho ng anti-IgE monoclonal antibody na ito? It will inhibit the binding of IgE to mast cell but does not activate IgE already bound to this cell and does not provoke mast cell degranulation. Okay, again, nag-i-inhibit siya ng binding ng IgE, and the action of IgE to the mast cells. So, walang mangyayaring degranulation. And that means hindi mare-release yung ating mga pro-inflammatory chemicals. And lastly, we will end here. This is the last slide. Let us just differentiate asthma sa COPD. COPD is chronic obstructive pulmonary disease. Si asthma kasi class, there is bronchoconstriction, but most of the time, asthma is easily reversible. I mean, the bronchoconstriction is asthma is easily reversible with the drugs we have discussed since Monday. Ang problema kasi natin sa COPD is, ano yan siya? There is bronchoconstriction. So again, there is limitation in the airflow. But most of the time, it's not fully reversible with the available bronchodilators natin. So ang problema talaga is their bronchioles na inflamed na talaga chronically. And that means maliit na talaga yung kanilang mga airways. Okay? So kahit bigyan mo sila ng bronchodilators, mahirap palakihin na kasi chronically inflamed na. Hindi yung inflammation kasi is a good thing if that is just a response of your body to get rid of, like example, bacterial infection or other infection by a microorganism or kung may injury siya. So it means na your immune system is working. What we don't want sa inflammation is if it becomes chronic. Just like sa arthritis, rheumatoid arthritis, nagiging chronic na siya. Kasi that will impede the normal life of the patient. And that includes the COPD. Okay? Nagiging na siya, inflamed chronically. So kaya hindi na siya nagre-react sa common treatment that we have. Okay? Now, 85%, most likely mga ganong cases, 85% most of the time with so mga people with COPD is actually a consequence of prolonged habitual cigarette smoking. Okay? So kung may nag-smoke sa inyo dyan, baon na ni siya ang panahon nga undangon na nato. Pero if you are habitual smoker na, yun ninyo stop dayon ha, kay magkasakit mo na. You have to decide sa sarili ninyo that you have to really stop, pero hinay-hinay. Okay? Gradual na biya sa cigarette smoking. Kasi again, aside from cancer, aside from the other consequences of cigarette smoking like sa cardiovascular diseases na ginakos nila, plus mostly sa mga COPD, mga smokers sila. Only 15% of the cases na sa COPD natin yung non-smokers. So they may be just second-hand smokers. That is why nagkaroon sila ng COPD or mga other pa na mga reasons. Okay? So this occurs in older patients and is mostly neutrophilic inflammation. What do you mean by that? The inflammation in the airways is caused by neutrophils, the action of the white blood cells, neutrophils. So mahirap yung COPD. Though actually, we also give the same treatment na like tiotropium, yung antimuscarinic agent natin na kapamilya ni ipratropium and yung mga salbutamol, binibigay pa rin natin yan sa COPD patients natin. Pero most of the time, mahirap talaga siyang i-reverse. So, I saw someone in the hospital with COPD. Talagang parang nag-a-asthma na mahirap huminga and at the same time, may sound, may wheezing yung kanilang paghinga. Pero as in maluy ka kay kanang naglisod jud siya og ginhawa, dili na siya maghigda. Matulog siya na nakalingkod lang. Kaya mahirap talagang huminga sa kanila class. So yun yung problem with COPD. I think ito yung cause of death ni ni Dolphy. Smoker din kasi siya. Okay? Sige, do you have questions? That's the last slide. DO1.